Good afternoon and welcome. I'm Jennifer Jones, the President and CEO of Fighting Blindness Canada. I'll be your host for today's Raising Our Sights Town Hall. Before we begin, I would like to acknowledge that in Toronto, we are on the traditional territory of the Haudenosaunee and the Mississaugas of the Credit First Nation. This land is also part of the Dish with One Spoon territory, a treaty between the Haudenosaunee Confederacy, the Anishinaabeg, and allied nations. As we have guests and community members from across Canada, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people for whom this land is home. Yesterday was Giving Tuesday. It's a really big day for the not-for-profit sector, and that makes this the perfect week for me and my team to say thank you for joining us and making the work Fighting Blindness Canada does, like today's town hall, possible. I'm excited to have the conversation today about work that will raise the profile of the vision loss community, the need for increased accessibility to care and treatments and cures, and the players who are making that possible. To do that, Fighting Blindness Canada's Dr. Elisabeth will moderate a panel of vision organization leaders about the impact of and hope for the newly passed bill that will help establish Canada's first national eye care strategy. Following that, I will provide a teaser for our new 5-year strategic plan that will guide how we will deepen and expand our impact on the vision loss community over the next 5 years. Then you're in for a treat as our own Morgan Einesen interviews Dr. Dave Gamm, a Fighting Blindness Canada funded researcher who has exciting news about his stem cell replacement therapy. For anyone wanting to ask questions, there will be an opportunity at the end of the presentations. There are a couple of ways for you to do that. You can use the QA box in Zoom, or please email us at education@fightingblindness.ca. Now I'd like to hand the mic over to Dr. Larissa Moniz.
Thank you so much, Jennifer. And welcome everyone. I'm so pleased to be here today to discuss what is a really momentous event in Canada. As Jennifer mentioned, Bill C-284, which was calling for the development of a national strategy for eye care, was approved by the House of Commons and more recently by the Senate and received royal assent on November 7th. And this marks a really significant advancement in Canada's commitment to eye health and vision care. The goal of the strategy is to improve eye care and rehabilitation services, to invest in research, and hopefully provide more treatments and cures while increasing accessibility and promoting eye health education more broadly. All in all, to ensure that all Canadians have access to essential eye health services. So the bill, what it does is it actually requires the government to develop the strategy. The strategy isn't developed yet, and so the government has 18 months to develop the strategy. And Fighting Blindness Canada has been working as part of a collaborative unit of eye health advocacy groups over the past 2 years to develop some of these solutions and to advocate for the vision loss community. So we're really happy to be able to hear from some of these partners today who will join us to discuss the importance of the bill and the impact that it may have for Canadians. Before we dive into the panel though, we have a really short video from the Honourable Judy Sgro. Ms. Sgro is a Member of Parliament for Humber River Black Creek, and she proposed the bill as a private member's bill and has really championed this vital legislation. She wasn't able to join us in person, but she has shared some thoughts in this short video.
Hello, I'm Judy Sgro, Member of Parliament for Humber River Black Creek. It is my great pleasure to be here today at Fighting Blindness Canada's Raising Our Sights Town Hall and to join those who are close to and are passionate about eye health so that we can celebrate. We have just taken a transformative step forward in addressing the silent crisis of vision loss. With the recent royal assent of Bill C-284, we will establish Canada's first national eye care strategy. Canadians living with or at risk of vision loss now have reason to hope for a brighter future. This milestone legislation promises not only to expand access to care and new treatments, but also to provide essential education on preventative eye care and to significantly invest in research aimed at developing prevention, treatments, and rehabilitation. The timing couldn't be more critical. Today, 1 in 5 Canadians, or 8 million people, live with an eye disease that could lead to blindness, and 1.2 million Canadians have already lost their vision. According to the 2021 report card on vision health by Fighting Blindness Canada and the Canadian Council of the Blind, the annual financial burden of vision loss in Canada is a staggering $32.9 billion. The new strategy's investment in research will also catalyze scientific advances in the fight against blindness. As the largest charitable funder of vision research, Fighting Blindness Canada has invested over $42 million in vision loss research since their inception and will play a critical role advocating for additional research funding in the National Eye Strategy. FBC is dedicated to accelerating the discovery of treatments and cures that will improve and, in some cases, restore vision for those affected by eye diseases. For Canadians living with vision loss, this act to develop a national eye care strategy represents more than policy. It represents hope. By addressing the systemic gaps that have too often left individuals struggling to access necessary care, this initiative aims to create a future where vision health is a priority for everyone. Thank you for your time. I look forward to sharing more information about the 284 Act as it progresses so all Canadians can experience the full potential of their vision, safeguarded by proactive care and cutting-edge research.
Thank you so much, Ms. Sgro, for your words. Joining us to discuss the strategy, we have François Couillard, the CEO of the Canadian Association of Optometrists, Elisabeth Fowler, the CEO of the Canadian Ophthalmological Society, and Jennifer Urosevic, President and CEO of Vision Loss Rehabilitation Canada. Welcome, and thank you all for joining us.
Thanks for having us.
Yeah, thanks for the
Thank you.
invitation.
Absolutely. So I want to kick off with a question about, we've heard a little bit about the strategy and what it could entail, but from your point of view, essentially, why do you think Canadians should care that the strategy has been, or the act has been approved? And how will it ultimately improve the eye health of Canadians? So I will start, just looking at my screen, I will start with Elisabeth. Why don't you kick it off?
Thank you. We believe the bill is important because for the first time, it really puts vision health at the forefront of the national health agenda. As Judy mentioned, so many Canadians are living with or at risk for vision loss. And as our population ages, these numbers are going to increase. And so we really need to have vision health be taken seriously by our government. And we believe that having this strategy will ensure that it's included in discussions about enhancing our healthcare system. And it does truly offer hope for those living with vision loss. So the COS, the Canadian Ophthalmological Society, and I noticed you didn't stumble on the word, so good for you. It's a rare one. Us and the other vision health partners, like Jennifer and François, are recommending that the strategy also include the establishment of a vision health desk, which we feel will elevate vision within the government ongoing, not just within the 18 months, but forever kind of thing. And so the bill presents hope and promise that the government cares genuinely about our vision and that we're committed to working towards a system that optimizes access to eye care, educates on how best to navigate the system, optimizes allocation of resources and expertise as best as possible on behalf of patients and with patient safety at the forefront. Finally, we're hoping that the strategy will help break down some barriers like language, geography, cultural differences, wait times, awareness and education, workforce distribution, and the ability for Canadians to access essential eye health exams. And finally, we hope that the framework will encourage more research into vision health because, as you know better than anyone, it's seriously underfunded in Canada and really needs to continue to work on innovative treatments that will offer more hope.
That's fantastic. Thank you, Elisabeth. François, I'm going to turn to you. So why do you think this bill is important for Canadians?
Yeah, well, hello first, and thanks for the invitation to participate in this panel. Thanks also to all the participants on the call for attending. Everybody's really busy, but this is an important town hall meeting. We need to pay more attention to eye health and vision care. Almost everybody will face vision problems at some point in their lives. And as Judy mentioned and highlighted again by Liz, over 8 million Canadians currently have an eye disease that could lead to blindness. Now, for some unexplained reason, governments haven't focused much on vision care up to date, but this bill will change that. So it will start a national conversation about vision care, and it will boost everything eye related all eye-related initiatives in this country. So it could lead to more Canadians getting regular eye checkups, better detection and management of eye conditions, and more funding for research. It could also speed up the approval of new drugs and devices. Additionally, it'll bring up for discussion national programs like those of Indigenous populations to address barriers to access in these national programs. So the strategy will take a comprehensive approach from all the way from preventing eye conditions to providing rehab services like those of Jennifer's team. So we think it's something that's way overdue, and we're fully behind it and very encouraged by the next steps coming up.
Thank you. And over to you, Jennifer. That was a good segue to vision loss rehabilitation.
Thank you, and great to be with everybody today. This is really exciting. I think back, over the course of my career in this field of, really having a national focus on vision hasn't existed, and now it does. I think our organization and what I'm most excited about is really around the integration of a federal strategy into the provincial and territorial healthcare system. So really making it a priority in the broader healthcare system. As my colleagues Liz and François have said before, this is not just about one area of vision health. It really is from the prevention, the research that needs to go into new treatments, technology to diagnosis, and then into rehabilitation or habilitation for somebody who's never had vision. I think these are the critical areas that most Canadians really do care about. It is something that people fear losing their sight, and to not have a focus in Canada, I think, has been a miss by our governments. So I'm thrilled about this strategy. I'm thrilled that the Vision Health partners have also come together to really focus on, what is best for all Canadians, because as we've heard, it impacts whether us personally or those around us. And I think that's the really important piece to focus on.
Thank you, Jennifer. I think that really sort of laid the groundwork of why the bill is important. So now I'm going to actually turn to François for the next question, which is the bill requires a development of a strategy in the next 18 months. So like thinking about it either from a personal point of view, from the CAO's point of view, at the end of this time, what would you consider to be a success? And sort of conversely, at the end of this time, if something isn't in the bill or something is in the bill, what would you consider either a disappointment or even a failure?
That's a great question. Thank you, Larissa. I think to start with your second part of your question, we will fail if the end result after all this work is a document that sits on a shelf without any tangible outcomes. That's what I think we all want to avoid. Success will depend on both what comes out of the strategy, but also the process leading into that strategy document itself. So the process itself is super important. It will be successful if it's inclusive, if it's thorough, if it's fair, respectful of all parties. Participants should all feel that they are on a learning journey together in search for solutions to enhancing the vision care for Canadians. That's how we're going to find the right solutions. And the strategy document itself should contain, of course, a summary of the consultations, but also a set of priorities that everybody agrees on or mostly agree on, hopefully, and related actions with clear accountabilities and deadlines. So that's what we'd like to see.
Okay. And Jennifer, from your point of view, similar question, what to you is a success and what might be considered a disappointment?
Yeah, for me, success at the end of the 18 months is, that those needed to be engaged, the community partners, people with lived experience are part of the build. That's, as François said, how we build really a sense of meaningful objectives. I'd like to see a comprehensive vision health strategy that has measurable actions, objectives that's based on, evidence. We've done a lot of research as organizations over the last few years to help support some of our advocacy efforts as well. I want to see clear timelines as well, with the hope of, the investment of funding commitments from the government. I think that's really important. So beyond the 18 months, there's going to need to be funding that helps to move some of these actions along. What would be, a disappointment in all of this is that if government takes an approach of not the proper consultation and a really narrow focus. We spent a lot of time really advocating for that continuum of care, from prevention pieces, right through until rehabilitation. And so each part of that is so critical. And I think that the other piece is that we really need to make sure that there's an equity lens on this, and that we really focus on ensuring that we're meeting the needs across this great country, in small rural communities to large urban centers.
Thank you. And over to you, Liz. What are your thoughts on sort of successes and failures?
So first of all, I 100% agree with Jennifer and François. I would say ditto on those. So truly, from the COS perspective, similarly, we'd like to have a framework that's solid, evidence-based, with clear milestones and guidelines, and that has taken the full spectrum of people into account. And that includes also the the provinces, because as they're the people who deliver vision health, we want to make sure that the unique perspective and the unique healthcare systems in each province is also, and territory is also taken into account. We also believe the strategy should be evidence-based, relying on research and best practices where possible. And that patients really should be at the center. So it's our hope that patients are provided with an opportunity to provide significant input into the strategy as well, and so that they have a voice in how the strategy rolls out. So, and also, ideally, we would love it, as I mentioned earlier, the thought of the Vision Health Desk, we'd love it if that was part of that framework, and that it is established to help roll out the strategy that will be, evidence-based, actionable, with milestones. And so similarly, we'd be disappointed if it's a big book that sits on someone's shelf and that nothing happens with it, or if some relevant stakeholders aren't included. And so the COS ophthalmologists, we're ready to work with the government and are looking forward to participating in the development of the strategy along with all the other vision health partners.
That is a perfect way to get to the next question, which was going to ask, what will your organization be doing in the next 18 months to ensure the bill is a success and has a real impact on Canadians? And also, just sort of picking up on something that both you said, Liz, and also something you said, Jennifer, about talking about the integration of the federal and the provincial. We know that can be complicated, like healthcare is delivered at a provincial level. All of your organizations work at a national level, but have a lot of provincial counterparts. So can you maybe also speak a little bit to how you think that integration could work, or how you will be working within your system to try to make sure that integration works? And I will start with Jennifer.
Thanks, Larissa. This is something I think we've given a lot of thought to, because we are a national organization that is both federally funded for 2 programs, as well as provincially funded and in the territories. So I think that there's a unique perspective. I think the most important thing for us is to be able to collaborate with the policymakers to make sure that our clients, the work that we do, and some of our experiences at the provincial health priorities and some of the work we've done in those areas could also lend some of the success or some of the things that we've learned along the way. And so I think that some of that integration and how you can work together and make sure that's an integrated approach. We do have to start with that national piece. So we'll be focusing, on collaborating with policymakers. We'll also continue, our outreach initiatives. We've had a lot of success in expanding our eye health screening initiatives, as well as some of the work that we're doing in rural and remote communities, which I think can add a layer of access that I think is really important. And then really strengthening, our ability to lend our voice to the prevention side of public education and awareness. And as we kind of look at, measuring and outcome evaluation on the continuum of care from the rehab, there's some evidence, I think, in what we see in client outcomes that can help to, influence some of the standardization and some of the pieces that we want to make sure that are really relevant in this strategy. And I have to say, one of the things that has been great for our organization is the collaboration with all of the Vision Health partners. And I think, continuing to build those alliances will make us as a stronger community going forward as well.
Absolutely. I have to say the last few weeks, as it was getting to the final stages, sort of seeing all the partners having their voice and their unique voice adding to it. I think it really shows the strength of the community all working together for one goal, which is really nice. Liz, I will turn to you next for the same question about what do you think the role of the COS will be in the next 18 months? And do you think you have a unique sort of perspective on the sort of federal and provincial integration from your point of view?
Thanks. Yeah. So the COS will similar to Jennifer, we're at the ready to continue to work with the other Vision Health partners and with the government and policymakers to advance the bill and to help develop the strategy. And so, if consultations are needed, we'll be happy to, send out notices, help spread the word, be active on social media. We're going to make sure our members are kept up to date and in the loop on the progress. And as physicians and surgeons who wind up dealing with the most serious eye conditions, I think our members have a lot of experience and expertise to give and are willing to share it with everyone. We have our own government relations work that, like all the rest of the partners, we've all been doing as we lead up to this. So we'll continue to make sure that that we maintain that. And I have to say, in the conversations we've had both with MPs and with the public servants, which I don't think is the word you use anymore, but with the bureaucrats, the people who work in the government, they've all been, I've not had one negative comment or feedback. So I think I'm really hopeful and positive about the potential and the potential outcomes that will come with this. And in terms of the provincial and the national organizations, so we work closely with our provincial societies, and we recognize that there's a role for the feds and there's a role for the provinces. And I don't think there's magic. I think it's about open communication, respectful acknowledgement of the expertise of the various, and then where the roles align, you need to make sure that you stay within that, but support each other within it. So again, I don't think there's magic to it, but I'm hopeful that we're maintaining these really wonderful relationships with our and I think we can carry that forward.
Thank you. Yeah, and François, I know the CEO has been really instrumental in helping push forward all the work around the bills. I think it's sort of fitting. I'm going to sort of end with you on this question.
Yeah, thanks. We've been very motivated to work on this bill to bring it to where it is now, and now going forward we're even more committed. So we're committed to working with all parties to provide relevant knowledge, information, and suggest policy changes, and also advocate for ways to improve vision care. Optometrists you can think of optometrists as the primary caregivers for vision in Canada, and they represent the largest set of eye care professionals in the country. We have about 7,000 optometrists in the country, and many more thousand optometry assistants who are also members of our association. So those are all ears and hands on the ground, and so we can use that vast network of professionals and clinics to collect data, spread information related to vision care. We certainly intend to work very closely with our sister provincial organizations to engage with provincial governments in the process and amplify the impact of this national strategy. That's a very delicate exercise, but our provincial associations are very used to working with provincial governments as they negotiate fees with them and discuss scope issues. So they're pros at this. We have very, very close collaboration with these provincial associations, as every member of the national association is also a member of the provincial association. So we will all work together on this and make sure that the information is relayed both ways as information travels. Yeah.
Thank you. So we have just a couple of minutes left in this part of the town hall. So if anybody has a question that they want to quickly put into the Q&A box, please feel free. And I'll wait a few seconds to see if that happens. But I also have another maybe follow-up question, and I'll start maybe with you, Jennifer, but anybody can jump in. You mentioned that you have sort of from research, from data, ideas and maybe certain initiatives that you might want to see within the strategy. I was wondering if maybe each of you, if you have an idea, could give an example of a specific initiative that you might want to see coming out of this strategy.
Yeah, I think bringing care closer to home is one of the most important initiatives. It is health priorities in every single province and territory, is ensuring that people have access to get out of hospital sooner. And so, being able to leverage technology to do some remote work, I think is one of the strategies that definitely will help to build. We need the infrastructure, though, around technology and access in some of these communities to ensure that. So I think that's, again, ways that both the federal and provincial governments and territorial governments can work together to achieve some of these success.
Yeah, I don't want to put either of you in the spot, but either François or Liz, do you want to answer the same question about a specific initiative that maybe from your point of view you'd like to see coming out of the strategy?
François, if you don't mind, I'll jump in.
Go ahead.
I would, my background is working with a lot of different research organizations, so it's something that's near and dear to my heart. But and I was astonished by how little the government funds in health and vision health research. So if there was a way to mobilize and provide more impetus to it, I think like it's at the base as well. Research, there's no new innovations, no new treatments. Not if we don't have more research. So that's one area I think would be really important. And then the other is equitable and quick access to drugs and new technologies. I think if there's a way that we can advance that, the COS has created an essential ophthalmic medicines list. We've shared it with Health Canada, but we would love it if we had a strong and consistent access to medicines, because particularly with COVID, there was a lot of disruptions and people just weren't getting medicines that were maintaining their sight. And so if there was a way that we could improve that, I think that would be really, really helpful.
Okay. Fantastic. And François?
I like all those suggestions. If I think of one thing that I hope this bill will achieve, it's some form of a national campaign supported by provincial governments to educate Canadians on vision care, vision conditions, and encourage Canadians to go and get their eyes checked. I'm not young, and when I was young, I remember getting bombarded on TV for ads to go and get my teeth checked, but I cannot remember anything about my eyes. And it's so important. I don't, if I lose a teeth, but if I lose an eye, I'm in trouble. And what we're hearing from Canadians is the main reason, the first reason why they don't get their eyes checked is they don't think there's something wrong with their eyes. So they have no symptoms. So they don't think they should get them checked. But that's false, as we all know. So there might be something underneath that you're not aware of that will lead to serious vision problems later. So figuring out a way to, in a cost-effective and impactful way, encouraging more Canadians to go and get their eyes checked on a regular basis, starting with children, of course.
Thank you. We have now run out of time, just as questions have started to pour in, but we will take note of all those questions for everybody who asked. And I think it sort of shows that we will need to do some more education around the strategy. So there were some questions about how much funding would be associated and who is leading the process. So really briefly, and correct me if I'm wrong, there currently is no funding associated with the bill, but hopefully at the end of it, Funding will be associated to be able to achieve all the work, but we don't know how much that is. And the government will be leading the development of the strategy with input from different stakeholders. Is that a fair statement?
Yes.
Okay, perfect. So thank you, Jennifer, thank you, François, and thank you, Liz, so much for joining us. And yeah, I'm going to turn it back over to Jennifer Jones now for the rest of the presentation.
I have to say thank you to all of you as well. I always learn so much every time we get together and I hear from your unique perspectives what the expectations are for all of us. I know what also came out of this is an understanding of there is a lot of work ahead of us still, but I'm very grateful that we're doing this together. Thank you for your time today in sharing your point of view with our audience. On behalf of our board of directors and my team, I'm now thrilled to present the Fighting Blindness Canada's 5-year strategic plan called Raising Our Sights, Vision 2030. This plan embodies our renewed vision to end vision loss caused by blinding eye diseases and our goal to expand and deepen our commitment to and impact on the vision loss community. Many of you likely know that for 50 years, Fighting Blindness Canada has been unwavering in its mission to advance research toward treatments and cures for blinding eye disease. Inherited retinal disease was our origin story, and it remains a focus, even as we've expanded over time into age-related macular degeneration and a few other eye diseases. We've also provided education, support, and advocacy for our vision loss community. And thanks to our donors' incredible generosity, we've reached extraordinary milestones. Together, we've invested over $42 million in research, $5 million in educational programs, and we've supported more than 230 grants, driving over 850 scientific discoveries. As we celebrate our 50th anniversary, we are committed to creating a brighter future for people affected by vision loss. To do this, we asked our community what their priorities are. They told us to fund more world-class research to develop new and better treatments, stop vision loss, restore sight, and ultimately find cures. They also need access to targeted educational resources and connections with each other, in particular, people who are facing very similar challenges. Our bold new vision and mission are rooted in these priorities and will guide everything we do as we move forward. To this end, I'm pleased to share our revitalized vision is ending vision loss caused by blinding eye disease, and our mission is to accelerate world-class research and provide expert information, advocacy, and connection for everyone impacted by blinding eye disease. And so what does this mean to you? The people who are listening to us right now, you're saying, that sounds great, but how is that going to impact the work that FBC is bringing to me? And I'll tell you that for those of you who know us well, it means a renewed commitment to being known for and operating as a strategic multi-eye disease organization, being a research and thought leader across the multiple eye diseases we focus on, as well as differentiating ourselves by keeping blinding eye disease at the core of everything we do, and using that to guide our expanding research expertise and programming that will deepen our connection to and impact on the vision loss community. Central to this strong brand that builds trust, sustainable and diversified fundraising, and operates with efficiency and effectiveness. Together, that'll get us to where we really want to go over the next 5 years. And so how are we going to do this? There are 3 key themes that we are focusing on. The first theme is expanding our community impact and connections. This means we will strengthen our presence in the inherited retinal disease community while optimizing growth in other eye diseases like age-related macular degeneration, glaucoma, and diabetic retinopathy. Some examples of work that you'll see us do is working with healthcare professionals across Canada to be a trusted referral for patients looking for information on their eye disease. Another example is that as eye diseases tend to affect people at different stages of life, we want to offer information and events very specific to eye diseases. So we've got people in the same room who are sharing very similar circumstances. The second theme is building our brand. And why is this important? It's because that by developing a compelling brand strategy, our mission will be better understood and will resonate with more people, helping to increase our revenue so that we can fund more research and programs. And here's examples of what you'll see us do in order to achieve that. We're looking at increased organizational presence across Canada through local activity and community engagement strategies like our Move for Sight fundraising event. Another is a strong strategic alliances with other vision organizations and research institutions, much like what you just saw today while we were speaking with François, Jennifer, and Liz. The third and last theme is building structure and capacity to scale impact. We'll build and align resources, systems, and culture so we're really fit for the work that we're doing, and we're able to scale our impact across the multiple blinding eye diseases and the millions of Canadians who are looking to us for that support. In order to serve that wider audience, but maintain our reputation for having deep research expertise and commitment to our community, we have to remain very focused, yet flexible enough to be able to respond to community needs. Some of this work is more about our internal operations, of course, but some of it will also directly touch our community. And those are examples of us launching a new volunteer program to support organizational objectives, as well as putting our donors and community members at the center of all the work that we do. And we really hope that you feel that every day. So to close this work is all in service of deepening and expanding our impact on the vision loss community. We are really here to serve you. I hope you see your dreams and expectations of Fighting Blindness Canada reflected in our strategic plan, Raising Our Sights, Vision 2030. If you're interested in reading the full report, it is available on our website, fightingblindness.ca. I think we're going to open it up in case anyone has any questions. And once we get through questions, we'll move into the last section of our program today. I think one thing I'll answer here is, while we did go ahead and we invited the community back in the spring, and we hosted several different focus groups to make sure that we had voices of people representing different parts of the eye disease journey, whether it was lived experience, caregivers, the healthcare professionals, certainly our staff and our board as well. So that collective intelligence meant the world to us, as we wanted to make sure that the work that we were doing was reflecting what you had told us your priorities are. One question we have here is, how will educational programs such as Viewpoint webinar series support the broader goals of this strategy? Yes, we know Viewpoint is really beloved, and we really want to continue offering more of them, both in person as well as virtual. In person, as many cities as we can get to, that's reasonable. And so you'll see us starting to announce those in 2025. One of the ways that we want to expand on the work that we're doing with Viewpoint already is take eye disease specific content to our community. Currently, what we're doing is we're hosting events that might be a half day because of the scale of the content that we're providing. And we mix IRD and AMD often together in order to reach as many people as possible. But as those populations grow, particularly AMD, we want to make sure that we are delivering very eye disease specific information to that group. And so we're looking at creating viewpoints specific to eye diseases. And so that everybody who is in the room, whether it's virtually or in person, is there asking questions and learning from each other when in a way that is really relevant to them. We're also looking at bringing coffee connections to different communities where it might be staff-led, it might be volunteer-led, but we want to make sure that we're bringing people together to have conversations around perhaps the science, perhaps the eye disease, but definitely in creating a peer support group. Because again, people who are facing the loss of eyesight have very specific concerns, questions, and interests in order to be able to understand what's happening, and bringing people together who have a very like mind is what we've heard from our community that they want more of. So that's an example of where we're going to take our Viewpoint. IRD will continue to be a focus, but we're going to now have AMD specific content as well. And the last question here is, how does FBC plan to strengthen collaborations with industry leaders, research institutions, and healthcare providers? I'll start with the healthcare providers. We are very, very lucky that we have some incredibly strong relationships with healthcare providers in different provinces. I think we're going to start to talk about creating a national steering committee so they can help us understand how we can be of value to doctors across Canada when they're supporting their patients. As you heard from François and Liz, you know, between the two of them, they have almost 8,000 doctors. And we know that those doctors are seeing patients all the time who are facing blinding eye diseases and are looking for answers to what is happening to them and what are the questions they should be asking? What should they be anticipating on their health journey as their eyesight diminishes? And we want to be the place that people can turn to act as a trusted advisor. And so we'll be looking to better understand how we can bring value to the doctor and the patient experience by becoming an easy referral for patients in that moment of diagnosis or over the time that they're visiting their doctor. And so when they're looking for information, education, and community connection, they can turn to us for that level of support. Okay. I think that's the end of questions at this moment. What I'd like to do right now is say thank you for joining for the work that we've done so far. And also now it is my pleasure to introduce an interview between Fighting Blindness Canada's Morgan Eineson and Dr. Gamm. Dr. David Gamm, he's MD and PhD, is a prominent ophthalmologist and stem cell researcher specializing in retinal degenerative diseases. He serves as the director of the McPherson Eye Research Institute and holds positions at the University of Wisconsin-Madison and as a professor of ophthalmology and visual sciences. He is also a recipient of Fighting Blindness Canada's 2018 Restore Vision 2020 grant and pioneered the creation of functional retinal cells from stem cells. Dr. Gamm's work focuses on human pluripotent stem cells to develop restorative treatments for conditions like retinitis pigmentosa and age-related macular degeneration. Based on the strength of this and other work he's done, this therapy was licensed by Blue Rock Therapeutics, which is a subsidiary of Bayer. And in September, Blue Rock announced that the FDA has approved launch of a first-in-human clinical trial to test the cell replacement therapy. Morgan Eineson spoke with Dr. Gamm to learn more about cell replacement therapy and what the potential impact could be for those with advanced retinal degeneration. We're now going to move to the video, and I hope you enjoy the conversation.
Hi, Dr. Gamm. Thank you so much for joining us today. It's really exciting news that Blue Rock has received FDA approval to test a photoreceptor cell replacement therapy, being an example of a therapy that could restore vision. So where is the field currently in terms of restorative therapies, and who do you think is the ideal candidate for a restorative therapy?
With regard to restorative therapies, there's really kind of two broad categories. So once you have undergone a condition that causes loss of photoreceptors, which are the cells that detect light. So it's the kind of the pinnacle of your visual system. So if that doesn't work, the rest of it downstream doesn't really doesn't work either. So once you've lost that, that trigger cell, the photoreceptors, then you have two options. You can either bypass them, try and get downstream cells in that circuit to do the job that the photoreceptors used to do, which is to respond to light. And that is being attempted through optogenetics, as well as through various prosthetics that are available right now. And that's very promising. Or biologically, you can try to replace those cells. And that requires, kind of two big, broad, bold things, which is you got to be able to make the spare part, in this case, photoreceptors. And they can't just be kind of photoreceptors. I mean, photoreceptors are the most complex cell types in your entire body. I'm a bit biased in that regard, but they're incredibly complex. They're neurons. They have to convert light to a chemical signal. They have to do so many different things. And so, really being able to make those, in a dish. So basically manufacture a bona fide human photoreceptor is not an easy thing. And you can kind of make one, or make one that if you squint maybe acts like one, or you can really try and make an authentic cell. And that's what we've been able to do, that we're confident that we're able to do, is the spare part is a real spare part. These are real human photoreceptors that are made at a stage that have the capacity to integrate into host retina. So that's a big part of it, right? You have to be able to make the parts that you need, and we can do that now. And do it at a very large scale, make billions of them, which is really critical to be able to conduct a clinical trial. You've got to be able to make the product that's going to go into humans. It's got to be made safely. It's got to be made in relatively large amounts if you're going to treat a lot of people with the same product. And it's got to be made in a manner that's safe for human use. So that's, phase one. If you can't do that, then nothing else really matters. Second one is getting it safely into the person who needs it, and having them connect. And so getting them safely into the person who needs it, that's a lot of work that's been done with the surgical approach, the delivery of that, how to keep them alive. Since in our case, they're not autologous, they're not from the patient back into the patient, because that's exceedingly expensive and time consuming for each individual patient, but rather it's kind of a one size fits all. So that involves some degree of immunosuppression. So that has to be worked out as well too. The connection portion of it, there's nothing, there's not, that relies on the patient and how that patient's or subject's retina is going to respond to these new cells. And there's significant evidence to show that depending upon the window where you're at in the disease, that can indeed happen. And so picking the right patients, at least when we start off here, that have the potential to be able to reach out and make that handshake with new cells is an important part of the upcoming trial too. And so we have to consider all those things. We have to consider what it is we're making, who might benefit from that, and where they are in the stage of their condition, such that they have a reasonable expectation of having an improvement occur after they're placed.
That makes a lot of sense. And then what would sort of differentiate this from something like a gene therapy is it's not specific to a particular gene, right? So this could be more widely used.
Right. So, a gene therapy is designed to fix a mutation or replace a gene in that particular gene or that particular mutation. So it's not going to help anybody with any other gene mutations. It's also designed to help folks who still have their photoreceptor still around, because that gene has to be replaced in the photoreceptor itself to get that photoreceptor to do its job better, and to be restored in what it can do. If it's gone, I mean, the analogy I always use is if you show up at a house with a new hot water heater and the house is gone, doesn't really matter. You can just throw the hot water heater on the corner. It's not going to do anything. So in the case of cell replacement, you're rebuilding the house. You're bringing a new house there with a new hot water heater, new everything. So it doesn't matter what was wrong in the house that caused it to deteriorate. You're giving a whole new house with all the accoutrements that are normally in it. It also means it's a lot more complex, a lot more difficult to accomplish. So I always tell folks, if you have an excellent gene therapy and you can get to your condition before the house deteriorates, before the photoreceptors die, then that's a better approach to go. I mean, it's always better to keep what you've got than replace what you've lost. So if you're early enough in the treatment and there's a treatment available and it has a reasonable expectation of working, that's a great way to go. But if you've crossed that threshold, those photoreceptors are not there anymore, then these gene therapies, genome editing, read-through, they're not going to help because there's nothing left there to work with. And so you do have to do the bypass or the cell replacement portion of things. So we're really looking at later stage disease courses. When I said earlier, we got to pick the right patients. We don't want to pick people really early because they've got really good vision. And why would you put good vision at risk for an experimental therapy? Conversely, if somebody is way far down the spectrum and has had, really bad disease for a very, very long time, their residual retina that we're trying to plug into may no longer be viable. And if that's the case, we don't want to put people potentially in harm's way either. We don't want to have them to undergo a surgery if there's not a reasonable expectation that they may benefit. So there are ends of the spectrum here that at least for the initial trials, we want to avoid, so that we can stack the deck in the risk-benefit factor ratio for the subjects that are involved with the trials.
Yeah, that's interesting. It must be very complex to figure out exactly what patients are the right patients to see to give this, because again, people think of clinical trials, they are an experiment, right? We're still testing this out. This is not a proven therapy.
Have inherent risk, yes.
Yeah.
And so, and we have to, the FDA's job is to make sure that, we've crossed all our T's and dotted our I's. I like to think that that we would do that anyway. That in fact the group that we work with, so Opsis Therapeutics, which is the company I founded, and then we're a subsidiary of Fujifilm Cellular Dynamics International, and then we collaborated with Blue Rock Therapeutics, which is part of Bayer. All those organizations, we're all safety first, and so I really feel good that our hearts and minds were in the right place from the very beginning. That this is something that none of us wanted to embark on unless we felt that it was safe, and again had that reasonable expectation of providing some improvement. And what we say is kind of a meaningful improvement. There's no expectation that people who have very poor vision are going to get their driver's license back. We're trying to take those first steps towards restoring vision, turning back the hands of time. But perfect is not in the cards. If we can make a measurable improvement that the FDA, we, and patients think is important enough, then we can go, like any technology, go back, make the changes we think we need to make it better, and iterate. Just like we didn't start out with supercomputers on our wrists, right? Or airplanes supersonic airplanes that can go across the ocean. You have to start somewhere, and that's kind of where we're at right now.
It must be a very exciting time to sort of be at the beginning of that and seeing the progress.
It is. It's also sobering. I mean, you have to, you lose some sleep here and there too, because you really want to make sure these are all patients, that I work with in my clinic, and these are people I've known, in this category, folks that have these conditions, not the individual patients, but I've interacted with folks that have retinitis pigmentosa and RP-like disorders since I started my clinic in 2003. And so, I'm very vested in this community, and, I think of them like, their extended family. And so, you want to make sure you do right by them.
Absolutely. So I know our community would be really excited to understand sort of the status of this clinical trial. So when do you think this first trial is going to launch? And we've talked a little bit about the goals, but what are sort of you hoping to see out of this first trial?
Mm-hmm. So we submitted the IND in the beginning part of July of 2024 this year, and we received FDA approval of the investigational new drug product about a month later. So it was relatively quick. It was a very thorough review by the FDA, and then they granted us the ability to move forward. And so, that the trial will be conducted by Blue Rock Therapeutics. They're a partner of ours. So we, Opsis Therapeutics and FCDI, we're the cell manufacturers here in Madison, Wisconsin. But the trial is being run by Blue Rock. And so the plans are going forward in earnest to initiate the trial, and the goal is to have that in 2025. So we're hoping that's going to happen. And right now we're making sure we have all the things in place in the various sites so that we can move forward.
So just as my last question today, I know some of this work that you're doing was supported by a grant from Fighting Blindness Canada. And I just wondered if you could tell us a little bit about what impact did this funding have for the success of your project?
Yeah, so I was fortunate to work with Fighting Blindness Canada back when it was Foundation Fighting Blindness Canada. And so I've been part of the FBC family for a number of years. And it's very, very important for me to give back, and like, for instance, to do this interview, and because it's one of the few organizations that really got in on the ground floor. And so, as one might imagine, a clinical trial costs millions and millions and millions of dollars, and one would not expect a foundation to bankroll that or what have you. But you never get to that point unless you build a portfolio that raises the interest of industry or granting organizations that have deep pockets and the ability to be able to survey the scientific and therapeutic offerings and decide what they think has the most potential. So to do that, like anything else, you've got to kind of have the chops. You have to be able to show them, okay, this is what we've done thus far, and this is why we think it's worth further investment to move it, down the line towards patients. Ideas are great. They're also a dime a dozen. So you have to have the pilot funding. You have to have the background to be able to show some tangible results that allow someone to say, you know what, that's intriguing. I think there's a reason to take another step forward, and then you do take that other step forward, and eventually you build up enough of a data background that somebody will say, okay, yeah, now it's worth making a big investment in this now. And so that's what FBC was involved in at the very beginning through a lot of really wonderful donors as well, folks who supported what we did at every level, and every dollar that was very important for us to be able to get where we are today. And what people also need to understand too is it's a vote of confidence too. It really does help to know that what you're doing matters to folks out in the community. I have the benefit of knowing that because I have a clinic, and I'm a pediatric ophthalmologist, so I get to work with folks in my clinic. So I see the need and I see the potential impact, and just the fact how much it means to just have the effort. The fact that there are people out there that are spending their entire careers trying to help folks that have blinding conditions. But a lot of folks who don't have that interface in a clinic, they work just as hard, if not harder, probably harder. But without that kind of feedback from the community that they're working every day to help. So that connection that the FBC provides between researchers and the community is just as important in my mind as the dollars are. Canadian dollars.
Well, I know we are all very excited. We've been sharing in our e-news progress along the way, and we will continue to do so. And thank you so much for all your dedication and all this work. We're really excited to see where it goes.
My pleasure. And again, thanks to FBC and everybody that supports you.
Thank you, Dr. Gamm.
Yeah, take care.
Thank you, Morgan. We're all a little jealous that you had the time with Dr. Gamm. He's been a name that we often speak of here in the hallways of FBC. So it was wonderful to be able to hear firsthand about his research and the success it's showing so far. This brings our program to an end. Thank you all for joining us today and contributing to this important conversation about vision loss and health. Your presence, whether you're a researcher, healthcare provider, advocate, or someone who lives with a blinding eye disease, it demonstrates the strength of our community and our shared commitment to our mission. The insights and stories today shared that remind us of the urgent need for continued research, education, and advocacy. By working together, we can continue to advance treatments, help to build community and connection, and bring hope to those affected by blinding eye disease. I'm leaving this conversation today inspired and engaged to support initiatives like the work to establish the National Eye Care Strategy and innovative research and educational programs. And I really hope that you are inspired and energized like I am. For together, we can make a real difference in the lives of millions of people across Canada. Thank you once again for your engagement and dedication. Let's keep raising our sights towards a future without vision loss. Enjoy the rest of your day.